Today we are here to discuss about the important aspects in psychiatric is process recording. Process recording is otherwise known as clinical process of recording, the method which is used in psychiatric setting to document and analyze about the interaction between nurse and patients as well as healthcare professionals who is psychiatrist, psychologist, social worker, nurse and other team members who is involved in treatment. So the primary goal it is to gain insight and attention about the persons through the therapeutic relationships which explore the patient's experience and improve the quality of care by the health team. So in this we are capturing the verbal and non-verbal communications and clues which cleanly observes and dedicated that what is the current patient situation's mindset and what he is needed. So by that it is a written account or verbatim recorded after immediately the nurse-patient relationships. So as now we move on to the definition. It is a recorded interaction between the nurse and patients. It includes the conversations between the nurse and patient and students' feelings, teachers' feedbacks. Here the process recording or the students attempt to create from the form of memory of verbatim transcend through the interview. The purposes it is mainly used to create a analysis about the communication and behavior of the individual which gain the patient confidence and cooperation. To that we can establish the rapport with the patients. By that we can study the patient's psychological, social and emotional behavior which increase their ability to identify the problem and develops the skill to solve them, which the students get an opportunity to gain and functioning about the experience which was experienced by the patient. The goals and objectives it is mainly used for establishing the therapeutic nurse-patient relationships and obtain the identification data, and through that we can get the information what is the exact issue of the person. By that we can go for the necessary health education, and at last through this conversation we can gauge that whether the patient has acquired the insight or not. Now we are moving on to the prerequisition of process recording. The process recording, before going to start a process recording, we want to get a consent from the patient as well as the caretaker. If possible, we can have the recordings. And here we should maintain the confidentiality, and the physical setting supposed to be arranged with a calm and quiet environment with all the basic facilities, which at last we have to provide the summary of the conversation. The application to nursing, it is a valuable tool for the psychiatric nurse to establish a good communication skill and identify the areas where we want to improve and developmental strategies to have effective therapeutic communications with the patients. By that it provides the basic concept of interacting with the patients. This will help the student's nurse to use various techniques so that he or she may develop the effective therapeutic communication with the patients. It will also provide a good interview with the patient with a skillful manner and guidelines to apply the knowledge in the clinical settings to interact with the patients to analyze what is the grassroots and undergone problem. The importance of process recording, which has enhanced the communication skill, self-awareness and professional growth, improve the patient's care and identifying the patterns, what type of care which we want to provide for the patient and which may have the effective results. So the advantages, it helps in differentiating the thoughts and feelings what was the patient having and clarify the purpose of interview or else intervention which is needed by the patient, and improves the written expressions and identify the strength and weakness about the patients. Next, helps to improve the self-awareness and actualizations on the patient's care, what we are doing it, and separate the fact from the judgment, which will explore the interplay of the value and operating between the students and nurses, student nurses and the patients for the analyzing of the process. The disadvantages, it is more time consuming and which have a technical problem because frequent we are not having the technical support, and which has an actual observation and subsequent participation in the clinical area where the clinical instructor and the students and patients were interviewing. The steps. So here we have 10 important aspects in the steps. First one is preparation. So whenever we are going to have a process recording, we want to prepare the necessary tools supposed to be get ready with the notepad, electronic devices and recording interactions. And next one is we want to get a consent. In the presence of medical professionals, we want to inform the thing what is going to be taken for the patients, that we want to elaborate it to the patient and the caretaker. After that only we want to obtain the consent. So the objective of the setting, what is the purpose and what we are focusing for the conversation, and that's supposed to be ensured in recording. Next one is active listening. So here we want to keenly observe about the verbal and non-verbal clues with the emotional changes to identify what is the exact problem and status of the patient which they are lying on. The verbatim dialogues. So here we want to point out what are the conversation and which was happened and what are the words exactly they have given through the conversation. And non-verbal clues here, apart from the verbal communications, we want to have the non-verbal clues such as body languages, facial expression, gesture, eye contact, mannerisms, which will prove that what is the emotional state and level of engagement of the patients. And emotional reaction, based on that your non-verbal clues, the emotional reactions and response which will respond for the patient statement and which helpful for the process recording in a professional aspects. So the reflection, based on your emotional reactions and the conversation, we will have the reflections about what was happened and what is the interaction which was going on, and what are the problems and themes underlining issues, how we want to start out that, what are the intervention settings, and where the patients can have a good results. And supervision and feedback. So whenever we are having the continuous process recording, that is we have to go for an proper supervisions which have the professional growth and effective clinical practices, which in turn we have the good results. So based on these 9 aspects, we can plan and provide the treatment which will gain the insight for the process recording. By that, the treatment plan will be executed easily and effectively for the patients. So the therapeutic communication, which has the 4 aspects. First one is pre-interaction phase, orientation phase, working phase and termination phase. So pre-interaction phase, prior to the first settings of the meeting, we have to have one-to-one conversation to identify and have a mutual relationships, therapeutic relationships among the patient and nurse, which own the confident and have a good relationships. So orientation phase, the nurse patient, they have the establishing the rapport and with the parameters what we needed, that is what is the underlying causes and how it was occurred, where now he is and what is the treatment, how we can able to go for that, whether there is having any interactions, any deformities. So these are all the things which we can able to be identified in the orientation phase. And in the working phase, we want to reduce the anxiety, then only we can go for an effective treatment. So by reducing the anxiety, we can have a good interactions. So to reduce the anxiety, we have a demo about what intervention which we are providing to the person in a safe settings, so that we can able to have a adaptive coping behavior for the patients. And last, termination. So if you achieved and if there is having any prognosis, then we can able to go for a termination phase and we can have a recurrent episodes. The process recording, the outline. So introductory material, so description about the patients, date, time, durations, what is the thought and feelings which we are going to have in the recording, and what is the reason we have chosen this. And objectives, prior to the meeting we want to have a clear objectives and specific functioning with the short term goal and long term goal. Short term goal, we want to first establish therapeutic relationships between the patient and nurses. Long term goal, the patients and family members who have to involved in the treatment, follow up and rehabilitation services. And third thing is interaction between the nurse patient relationships. Truthfulness in recording supposed to be established and it's supposed to be maintained with the confidential. And observe the verbal and non-verbal clues, and own thoughts and feels should be away from the interactions, and we are the overall responsibilities toward the patient interactions. The analysis, we want to interact with the verbal and non-verbal thoughts and the feelings, communication techniques, how it was. The time required for this is 30 minutes, actually 20 minutes of active interaction and 10 minutes of conclusion planning for the next intervention supposed to be taken off. The summary is supposed to be conclude what is the exact objectives, whether we have meant with the initial objective or not, and brief analysis about the reasons, what is happened, how it is happened, and what other treatment is going on. Last thing is introspect. After completing your process recording, we want to introspect about the psychological process which involved in looking inward about the examination of one's own inner thoughts, emotion, judgment, prediction, perception, etc. So here it is a sample of layout for the process recording with the student name, a date, client system, presenting issues and purpose of observation. So in here, phases, nurse's response, patient response, therapeutic communication and inference. In the phases we are having, as you know, that pre-interaction, interaction, working phase and termination phase. While we are having the nurse's response, we have to obtain the verbal and non-verbal response of the nurses and verbal and non-verbal response of the patients, and what are the therapeutic communication tool which used in this conversation and inferences. So these are all the things which we want to be identified and recorded. So it will be useful to have a keen observation about the verbal, non-verbal and communication techniques, everything without having any misses. So here is some of the process recording example samples which was happened in the hospital settings for the students and through the crisis intervention. So these are all the things, some of the ideas. So these are the textbooks which was referred for the process recording. Thank you.